The gruesome reality of amputations in the American Civil War. Next, as soldiers lay dying all around them and others awaited attention, some screaming, some in shocked silence, the surgeons in blood-splattered clothes went to work, sawing through bone. Their task was to sever the pulverized limbs and shattered bones of those who had been hit by deadly bullets shot from the barrels of rifled muskets. Amputations conducted on such a large scale had never been seen before. If the evidence of apparently amputated bone stumps and saws made of stone are anything to go by, amputations have been practiced since Neolithic times. It is during periods of war, however, that the greatest leaps in this surgical procedure have taken place, simply because of the sheer numbers of amputations required in wartime. During the American Civil War, 1861 to 1865, a conflict in which over 70% of recorded wounds were to the extremities, an astonishing 50,000 amputations were performed. Although gunshot wounds to the abdomen from these lethal rounds invariably resulted in death, with injuries to the arms and legs of troops, there was at least another option. Indeed, so mangled were the limbs of those who had been shot that the medic usually had little choice but to perform an amputation. It was either that or leave the stricken soldier to face the likelihood of a fatal infection. The surgical conditions during the Civil War were appalling by today's standards. However, that's hardly surprising given the relative lack of medical knowledge at the time. The idea of a sterile environment was not yet recognized, and the chaos of battle, which would have been felt by one and all. One surgeon stated, "We operated in old blood-stained and often pus-stained coats. We used undisinfected instruments from undisinfected plush-lined cases. If they had sponges, or instrument fell on the floor, it was washed and squeezed in a basin of water and used as if it was clean. After the limb had been cut through with a saw, the amputated limbs were often simply thrown outside the surgical tent into ever-mounting piles. Then it was on to the next patient." Because of the tremendously unsanitary conditions, a heavy mortality rate arose from so-called surgical fevers. These were conditions like pyemia, a particularly virulent form of blood poisoning, and tetanus, both of which killed around 90% of those afflicted, as well as other diseases such as the now extinct hospital gangrene. After seeing to the wound with a wet cloth and probing with a filthy finger for bits of bone or the bullet, the surgeon would make a call on whether or not to amputate the limb. Scalpels or knives were then used to slice through the skin and muscle, and bone saws employed for the work their name implies, hence the Civil War surgeon's nickname, Sawbones. Upon completion of the procedure, the operator would tie off the blood vessels with horsehair or cotton thread, scrape the bones smooth, and then sew up the skin around the site of the amputation, with opening left to allow fluid to drain. Finally, bandages were applied to the stump. Anesthesia was in its infancy during the time of the Civil War but was nonetheless in widespread use, doubtless to the welcome relief of those being operated upon. At least the surgeons generally had a rag soaked in chloroform to help relieve the patient's pain, at least for the time it took to perform the surgery, before the tourniquet was applied above the site of the wound and the business of slicing and sewing began. Amputations were over with quickly. They could take as little as 10 minutes in some cases, but they had to be. The mortality rate doubled for those performed more than 24 hours after the injury was inflicted, and yet the wait for treatment could easily be a day or two.